From Humble Beginnings, the story of Elizabeth's first hospital. In the period following the Civil War, Elizabeth, New Jersey became a major manufacturing hub and shipping port for products sent out to the rest of the world. As it evolved into a city, the delivery of medical care became a major public health issue and proved to be a strain on the area's physicians. Doctors were tasked with seeing patients at their office, or by making house calls using a horse-drawn carriage, or traveling on horseback, or walking if necessary. Through all kinds of weather, doctors saw patients in their homes or at sites where people were ill or injured and too sick to be moved or to travel. The need for a more organized way to provide care was acute. A more modern approach was required. Several physicians saw an opportunity to garner public support and raise the money to purchase and equip a hospital. This newfangled concept quickly caught on as the public saw the value and felt the need. What was it like to try to provide medical care at this time? Various types of medical and surgical kits were used by doctors, depending on their medical specialties. The newspapers of the day were also filled with hundreds of potions, elixirs, and cures for people's ailments. Needless to say, it was difficult for all parties concerned. As the population expanded, another place was needed where patients could receive medical care outside the home. A free dispensary, or what we would probably refer to today as a free clinic, was just what was needed to address the problem. Dr. James S. Green is credited as being the central figure in the organization and creation of the first hospital in Elizabeth. Dr. Green, along with fellow physicians Alonzo Pettit, J. Otis Pineo, and Thomas N. McLean, pooled their resources and decided to build the case for a hospital in town. At the time, there was little money to fund such an endeavor, so they decided to take a step-by-step approach and begin by opening a free dispensary. At the same time, Dr. Green was active in local civic groups and in politics, serving on the first city council and also serving a one-year term as mayor. It helped Dr. Green to have a public platform he used to press the need for a hospital. And so, on April 17, 1877, the doctors announced the opening of their free dispensary for the treatment of surgical diseases of the poor on West Jersey Street, 3 doors from Broad Street, with an ad on the front page of the Elizabeth Daily Journal. A few weeks later, a law was enacted in the state of New Jersey that enabled the creation of corporate entities to provide various types of health care. Several months later, the doctors, along with numerous members of the community who began to rally around the cause, filed the papers to incorporate as Elizabeth General Hospital and Dispensary on October 17, 1879. During the first 2 years of operation, the free dispensary was providing the proof of concept for the need, so a search committee was appointed to find a more suitable location. A property was available on Jakes Street near Elizabeth Avenue, so plans were undertaken to acquire the property. Although the home was not configured to serve as a hospital, it did provide a much larger space and a relatively convenient location at 18-20 Jake Street, between Elizabeth Avenue and East Jersey Street. As it grew, it was not long before this fledgling hospital was also deemed too small to meet the demand. A group of fundraisers rolled up their sleeves and conducted campaigns designed to raise the money necessary to take the next step. There were a number of ways monies were raised, with local churches and other civic groups participating in the fundraising efforts. Mite boxes were also placed at various locations for people to drop in their small contributions in support of the cause. Entertainments of various sorts were presented, and profits were donated to the hospital building fund. This was an easy way for the general public to show their support for the new hospital that was being planned. They had a good time in the process. Prominent business and civic leaders were also very involved in evaluating and selecting sites, purchasing land, and finding additional locations for nurses to be housed. It should be noted that while the physicians, nurses, and support staff were hard at work, this other team was equally busy. After all, the idea of a hospital was both new and complicated. At last, the Elizabeth Daily Journal proclaimed the grand result as the fundraising effort was completed. Groundbreaking and construction could now begin. Through all of the difficulties and the rough times, the people of Elizabeth rallied behind their doctors and their quest to create one of the first modern hospitals in America. The time had finally arrived, and the new Elizabeth General Hospital and Dispensary was opened on April 26, 1894. Sadly, Dr. Green passed away before his new creation was fully realized. Fortunately, he was able to attend the groundbreaking for the new hospital in 1892, several weeks before his passing. The new complex included several buildings along East Jersey Street and extending along Reed Street. At the same time, the Blake Memorial Hospital for Women was integrated into the complex. It provided a place for women to deliver children and receive other types of care in a building designed just for them. The Blake was a generous gift to Elizabeth General from Mrs. Frederick M. Blake in memory of her parents. One of our rarest items is a silver spoon sold as a gift to commemorate the birth of a child and possibly later to feed a baby. It has images of the hospital buildings and the words Elizabeth General, Blake Memorial, and Cribside Souvenir inscribed on it. Some early annual reports contain images that provide a look inside the Blake Memorial and what state-of-the-art medical care looked like prior to 1900. Eliza Gracie Halsey was also an important figure in the history of the hospital. Her Daisy Bed letter in the local newspaper encouraged the children of Elizabeth to donate pennies, nickels, dimes, and quarters to fund a children's bed, which eventually became the Daisy Ward. As a reward, the children had their names published in the newspaper once a week. Over the years, buildings were replaced. The campus was expanded. And expanded as Elizabeth General became a regional leader in delivering behavioral health, cancer treatment, and pediatric services. And grew again with Elizabeth General's acquisition of the assets and assuming the operation of the Alexian Brothers Hospital facility. Then, in the year 2000, for the sake of the community and the continuance of quality healthcare services in the region, Elizabeth General Medical Center and St. Elizabeth Hospital consolidated to form Trinitas Hospital, now known as Trinitas Regional Medical Center. Over the years, thousands of nurses have been trained and graduated from one of the finest nursing schools in America. Founded in 1891, the Elizabeth General Hospital School of Nursing continues to flourish today as the Trinitas School of Nursing. Many graduates work at Trinitas, at other hospitals, and in other settings throughout the U.S. and around the world. Teams of professionals delivered compassionate care. In every department, in every case, the employees of the General provided outstanding medical and social services that continue today at Trinitas. From day one, fundraising has been the backbone of providing programs and services and building or renovating facilities. Community involvement and participation is essential to the success of most fundraising campaigns, and we appreciate the support of all of the people who have given their time and talent to help us, to help others, over the years. As people remember our humble beginnings, that started with one man's vision to establish a hospital in Elizabeth, New Jersey.